Welcome back to the Morning Blend. Lower your risk and get healthy. Through positive change, you can prevent diabetes or control it.
And here to show us how, Breezy Bolden, branch executive with the YMCA of Southern Nevada. How are you, Breezy?
Hello. I'm doing well. Thank you for having me.
So let's talk about diabetes. This is a very widespread issue here, especially in America. Let's talk about how many people have diabetes and are on the cusp of diabetes.
Sure. So 29 million Americans already have diabetes.
Wow.
79 million Americans have prediabetes. That's 1 in 3. One in 3 adults have prediabetes.
Is it something that's genetic or something that we're doing to ourselves slowly?
A little bit of both. A little bit of both, quite honestly. Genetics is definitely involved, but the way our culture is nowadays, diet, exercise, we like things fast and quick and in a hurry, and those things also contribute to diabetes.
And what exactly is that?
Diabetes?
Yes.
So diabetes is it is a very prevalent disease that's affecting millions of Americans, more so than it ever has before. It has to do with the pancreas and the way it is producing insulin and handling that. And so the WISE Diabetes Prevention Program really targets individuals that are at risk for developing type 2 diabetes and helping to prevent or delay the onset of that.
Absolutely. Now, tell us about the Diabetes Prevention and Control Alliance.
Sure. So the Diabetes Prevention and Control Alliance is a component of United Healthcare, and they are somewhat of a sister company, if you will. They're the gap between the Y, who is delivering the prevention program, and the insurance companies who may cover this as a benefit.
Yeah.
Okay, and what do we need to know in order to prevent something like this from happening to us?
In order to prevent type 2 diabetes, physical activity, increasing physical activity to 150 minutes a week, and also losing a modest amount of weight. For every 2.2 pounds that you lose, you decrease your chances of getting diabetes by 13%.
No kidding.
So it's just a modest amount of weight loss that can reap huge rewards.
So for people who have gotten control of their diabetes, have you noticed that they're no longer on medicines, or once you're on medicines, you're always on it?
So that's a great question, and I think that fluctuates by the individual, and they would really want to speak with their healthcare provider. Yes.
Let's talk about some of the other partners that are involved as well.
Sure. So United Healthcare, huge partner, huge, nationally and locally.
And it makes sense for them to stop people from getting diabetes because it makes for less insurance payouts. It's a great thing.
You are exactly right about that, yes. So United Healthcare and individuals with United Healthcare, Health Plan of Nevada, or Sierra Health and Life, they may have this as a covered benefit, the Diabetes Prevention Program, as well as the Diabetes Control Program. So they'll want to contact their insurance companies. But there's also other partners involved through the Y who provide financial assistance for people who don't have insurance but really want to make a healthy lifestyle change. We can provide financial assistance to folks, so we have those partners as well, and people can always self-pay for the program.
Absolutely.
Yeah.
And let's talk about, again, some of the ways that we can control it, because I think people are thinking, what can I do to get this in control or help prevent it in the first place? So it's food, exercise.
Yes. So the prevention side of it is key. 79 million Americans have prediabetes, so that's a huge component.
And if they make a change in their lives, they won't get to that next step.
Exactly. So on the prevention side, it's really about healthy eating, physical activity. The program has 2 goals: 7% weight loss. That's a modest amount of weight loss. And increasing physical activity to 150 minutes a week. That's 30 minutes a day, 5 days a week.
This is all stuff we should be doing anyways.
Yes. But those are just simple components to reducing your risk for diabetes. Now, individuals that already have it, they really want to work with their physician, their health plan provider, their local pharmacist, etc., to kind of do some of the same things that you do to prevent diabetes to get it under control. But there may be some extra steps involved.
Now, if your parents have it or your siblings or aunt and uncle have it, then you should probably get yourself checked as well.
Yes. If you have a history of it within your family, you may be predisposed to diabetes, and it's something you definitely want to monitor. And don't be afraid to ask your physician to test you, to give you an A1C test, and figure out where your blood sugar levels are, and see if it's time to make a change and intervene in your lifestyle.
Better to be safe. It's a pleasure. Breezy, thank you.
Thank you so much for having me.
All right, knowledge is power. Diabetes threatens 1 in 3 Americans, and if you'd like to learn more, just head to the website notme.com/DPCA, the website for the YMCA.